Hi everybody, welcome to the last week of lectures, and this week we're going to look at chapter 17 and 18. Chapter 17 talks about global health in reproduction and infants. This quotation from a reverend in Rwanda is pretty powerful. It says, "In my country, the time of birth is associated with fear because so many mothers and babies die. It seems that no one notices women and children dying. Are we invisible? It feels that way to us." This is a very profound statement, not just for Rwanda, but around the world as different countries struggle with infant mortality and also maternal mortality. So a little bit of background, maternal and infant mortality is the key indicator of international health development. So at the very basis of looking at a country's health development and the programs that they are implementing to help health within their country, it really shows a key indicator of that development, specifically on the maternal and infant mortality rates. Maternal mortality and HIV and AIDS are two leading causes of death among women of reproductive age worldwide. So HIV/AIDS is a really major issue around the world, but maternal mortality in some ways could possibly be prevented, but it really is not being looked at as strongly as it should be. And so the Millennium Development Goals, which we've talked about throughout the term, call for a reduction in maternal mortality. They see that it's really important to start putting more emphasis on preventing this from happening. So this is also the case with infant mortality. So newborn survival has slowly improved compared to maternal mortality, and a newborn is considered birth to 28 days. And so in most regions around the world, that that has slowly improved, but unfortunately, it is not moving as much as we would like. Now, maternal deaths can have terrible consequences for the whole family, and child deaths are often linked to maternal health via perinatal causes. So oftentimes, even if the mother lives or dies, then the newborn can also pass from the different causes that they received from their maternal health. And so with that, it's really important that worldwide we start focusing more, not just on the health of, the babies and the children's and the newborns, but also the care for the mothers. And so your textbook talks about that the risk of maternal death is highest within 48 hours after delivery. So there's a lot of different maternal health indicators that are provided as needed for importance. And some of those are basic services such as clean and reliable water, sanitation facilities, electricities, power generators, sterilization of medical equipment. So, if a mother is in there giving birth to their child and, things aren't sterile, they're not using clean water, those can be some major issues. General medical services, so blood banks, biochemical and clinical laboratories, adult intensive care units. The problems that can arise around the world is that not every hospital or place that mothers have these children are like those that we are accustomed to in the United States. Oftentimes there isn't a sterilization room. There aren't people in, sterilized gowns with gloves on ready to, help the birthing process. And so if something happens where, the mother starts to kind of bleed out and there's not a blood bank readily available, then that can lead to maternal mortality. There's also sometimes basic lab screen testing that are missing, so including testing for protein in the urine, HIV, syphilis, and completing urine cultures. Anesthesia, which includes doctors, nurses, and paramedics within the hospital. So again, like I said, if the setting is not necessarily what we're accustomed to in the United States, you may not have anesthetic. Now, while some individuals are okay with having a natural birth, if they have to go in and do a C-section, that may not be something that's available for them. which leads to emergency obstetric services. So that includes oxytoxic drugs, anticonvulsants, blood transfusions, maternal cardiopulmonary resuscitation, hysterectomies. So a variety of different things that have to happen in order for a mother to survive a emergency within their birth. All of these different things are needed and are super important. And then also at least one OBGYN resident on call and a continuous education program. So who these mothers have birthing their babies is super important, and we hope that an OBGYN is with them, available. I know some countries and individuals choose to have a midwife, but someone with, you know, an educational program behind that is highly important. It's not just, you know, maybe grandma over here who's helping, you know, helping you birth the baby. They may not be able to provide, you know, the blood, the medicine, and the different things like that that are available to you as you're birthing the child. So reproductive health is super important in that regards to newborn survival and also maternal health. So the definition of reproductive health is a state of complete physical, mental, and social well-being, and not merely just the absence of disease or infirmary, in all matters relating to the reproductive system and to its functions and processes. So oftentimes a lot of people think that health is just the opposite of that is the absence of disease, and that's not the case. Reproductive health is impacted, you know, physically, mentally, and socially. So it's not just the physical body that is impacted or needs to be examined in regards to reproductive health. So your text talks about that, you know, reproductive health care, it's a constellation of methods and techniques and services that contribute to that reproductive well-being by preventing and solving different health problems, and also includes sexual health. So, you know, reproductive health care wants to look at an individual's physical, mental, and social well-being in regards to their reproductive system. So something that comes from that reproductive health are preterm births. So we talked about newborn survival. Approximately 15 million preterm births, which is before the 37 weeks of gestation, occur every year. Many of you probably know someone who, you know, either is considered a preemie or has had a preemie, a premature birth, and, you know, thankfully, a lot of children do survive from that. However, preterm children also have a greater risk of childhood illnesses as they get older. And so it's important that, you know, during the first month of life, they are, you know, taken care of, because they have increased risks of respiratory infections, you know, nervous system morbidities. And so you can see 1.1 million will die due to complications every year. And so some causes of preterm delivery that people don't always know about are young or advanced age. So, you know, if it's someone who's maybe having a child at 12, 13, 14, 15 years old, and their body isn't totally developed, you know, ready to have a child, that can cause an issue and possibly cause a preterm delivery. Also advanced age. We know that Janet Jackson had a baby at 50 years old, where, you know, health care individuals advise maybe not to have children that late in age. There's a risk available for a preterm birth as well as other things. It could be your race if you've had multiple pregnancies. So if anybody's familiar with the 19 Kids and Counting, the mother, you know, wanted to have a 20th child, but the 19th child was a preemie, and the doctors advised her, you know, you've had 19 different children, clearly multiple pregnancies, it's probably good that you don't try to have a 20th child. There might be shorter pregnancy intervals, infections, lifestyle factors, psychological factors, and also genetic predisposition that comes with why preterm births can happen. So in looking at reproductive health, we have to look at reproductive rights. So most of this information is looked at from the United Nations Program of Action of the International Conference, specifically on population and development. And so many of you have probably heard the term monarchs. So that is the age at which reproduction is physically possible. And so that varies greatly across societies. So as I mentioned before with the preterm births, if that person is not necessarily, fully developed at the ripe age to be able to produce, for it being just maybe physically possible just after it's become physically possible, that can cause some major issues. So in the United States, about 1 million adolescents between the ages of 11 and 19 become pregnant every year, and 500,000 give birth. About 14 million young women worldwide ages 15 to 19 gave birth each year. And teen pregnancy rates have declined during the last 25 years in developed countries, but that doesn't necessarily mean that it has gone away. So, it's still something that needs to be examined, and individuals need to be educated in regards to teen pregnancies. Abortion rates for teenagers in developed countries vary greatly. It's difficult to really put a strong statistic down in regards to, the rates, because not every country documents that different information if abortions are occurring, whether they're legal or illegal. So it's hard to determine that. And then sexually transmitted diseases are disproportionately affecting teenagers as compared to older women of childbearing age. So syphilis, gonorrhea, chlamydia are becoming more frequent among teenagers. And then the last point are cultural influences. So in regards to adolescent reproductive health, this really directly affects a lot of programs and policies in regards to reproductive health. And so your text talks about that, the Islamic law condemns prostitution, homosexuality, and premarital sex. And so the Quran has an impact on whether or not they can establish reproductive health programs for teenagers in a lot of Muslim countries. It also talks about that in Morocco, which is a mostly Muslim country, there is an opposition to sex education and condom promotion for unmarried adolescents, where in other Muslim countries there are clear guidelines for sex education. So one thing that I always like to mention in this course, and especially during this time, are, there's a lot of restrictions against adolescent sexual behavior and reproductive health, but then there's also some, I guess you could say, kind of pro-adolescent sexuality. So if you want more information, you can check out the Cambodian sex huts. So in Cambodia, the fathers actually build a sex hut for their daughters between the ages of 9 and 13. And so the idea behind it is that it gives these young girls, they're empowered to control their body and their sexuality and who they have sex with. So kind of the opposite of some of the social thinking in the United States, where, specifically in heterosexual relationships, it's like, oh, the guy should pursue the girl, they're the ones that are going to probably initiate sex. And it's actually the opposite in Cambodia. Now, the girls can only have sex in their specific sex hut. They don't have to, so they can bring boys in and kind of hang out with them, talk to them, whatever, within their sex hut, and they don't have to sleep with them. But if they want to, they have that choice, and they have a place to be able to do that that was actually built by their parents. So I find that that's something that's super interesting, where, a lot of countries are kind of pro-adolescent reproductive and sexual health. So something that we have to look at in reproductive health is fertility and infertility. So fertility is the age of childbearing, which varies greatly among different countries. So, not everyone is of childbearing age at a certain time, or, it's the same age for every country. That's not the case. In most major areas of the world, however, majority, 2/3 of childbearing takes place before age 30. So that's something to look into, not only within the United States, but outside of the United States, that most of the time women are 30 and under. But something that is having an impact on fertility is that women are having children later in life and are also having fewer children than previous generations. So some of you may have, parents and grandparents who are one of 12 or one of 15, where, more often nowadays the max number other than the Duggars in 19 you might hear could be like 6 or 7 or even 5, 4. It just depends on the family. And so the lower fertility rates, especially within developed countries, have been, attributed to things like industrialization, urbanization, modernization of societies, improved access to education, improved survival of children, and also an increased use of contraceptives. So one thing that your text mentioned that a lot of times I don't think people think about in regards to fertility are that men are physiologically capable of reproducing longer than women and often marry later and become fathers at older ages than women. So sometimes you'll see on a news story or hear about some, celebrity gossip of a older guy having a, maybe younger wife and how they're having a child while he's, 63 and she's in her 40s or whichever way it is. Well, here's why. Because men are capable of reproducing longer than women. So then we have to look at infertility. So, not just fertility, but infertility. So this is the biological failure to conceive by normal sexual activity without contraceptives and the inability to carry a pregnancy to full term. And so infertility really does affect both men and women of reproductive age. So if anyone's ever had difficulties, conceiving a child, oftentimes they'll check both, the man and the woman. They'll see if there's something wrong with the eggs or if the sperm, just aren't able to, reproduce, if they're not fertile. And so infertility does affect men and women. Infertility, your text talks about a variety of different ways that infertility can exist, but one of them that's super important is unsafe abortions, which may be responsible for these different problems, especially within countries of transition economies. So, if abortions are illegal and there's not safe medical care available once the, abortion happens, and then before or after, it can really have an impact on the woman and potentially cause infertility if it's not done safely. So something in regards to fertility and infertility I thought was fascinating within your text was that in the Arab culture, the bride's status in her husband's household is unstable until she gives birth to her first baby to make sure that she is fertile. She is then obligated to have a second child because of the fear that an only child may die and leave the parents childless. So it's kind of like the idea they almost have to have two. The first one to make sure you can have a baby, and then the second one to make sure that if that other baby or other child dies, there's hopefully one still available to care for the parents. Next, we have contraception. So most of the common forms of contraception in the United States I have listed here, and then on the right-hand side, kind of a picture if you haven't seen some before. So there's oral contraceptive pills, usually called birth control pills. There's female sterilization. There's male condoms, male sterilization, and then injectable Depo-Provera, and then there's a variety of other different kinds, some that are not used as frequent as they used to be, and then it really just depends on the individual. So one thing that your text talks about is emergency contraception. So more specifically in the United States that it talks about is a drug that you can take that is available to prevent pregnancy when taken within 72 hours of unprotected sex, and most of you probably know this as called Plan B. And so depending on the pharmacy, it ranges about $50. I've seen it, and so that is a form of emergency contraception that an individual might use. So along with contraception comes family planning. So family planning is, something where people can plan to decide the number of children that they have, the spacing in between them, the timing of the births of their children, and research clearly links adequate spacing of birth of children with a decrease in maternal and infant morbidity and mortality. So they found that, being able to control the spacing of your children, so you're not having them within 12 to 18 months, you're able to space it out, actually helps mothers to live and also the infants that are being birthed. And so family planning services should be integrated within primary healthcare services. So this includes education, counseling for informed contraception decision making, care for STDs, cervical cancer screening, and also breast cancer screening. So oftentimes the family planning services really have a purpose, and they're available to promote gender equality and empower women and families. It gives women that power and ability to, space out when they're pregnant, when they have children, and also the timing of that. It's not just necessarily, leaving things up to, whomever, or whatever they believe in, but they can have some control over that. Family planning can reduce the maternal deaths, as I mentioned, by 32% and the deaths of newborns and children by 10%. It can also potentially decrease unwanted pregnancies by 71%. So that use of contraceptions can, help decrease unwanted pregnancies. So by using that protection or the, birth control pill and other things, it can help to decrease those unwanted pregnancies. And then it can also decrease HIV transmission as much as 80% with the promotion of consistent and correct condom use. And then it also slows the population growth, thereby significantly reducing poverty and hunger. And so that's something that's extremely important. Is a lot of times people don't realize, when they're having multiple children, that, it does sometimes affect population growth. It can impact a community's economy, and it can have an impact on a variety of other different things within their family itself. And so family planning is something, while not always talked about specifically under the terms of family planning, more so about, kind of sexual health. All of these different things are important, especially worldwide. So I had a friend who in high school, she was a part of kind of a mission trip, and one of the things that they did while they were in Africa was they talked about the way to properly use condoms. So HIV and AIDS was so rampant at that time that, they found that really these people down there didn't know the importance of using condoms and how that prevented the spread of HIV/AIDS. So they were really pushing to not only prevent, maternal mortality and infant mortality, but also just, fatality in general for the population. And so they would hand out condoms and, talk to them about the proper ways to wear them and not to have multiple partners. And so that was something that they really worked towards in Africa. So one thing that is important to talk about is abortion. So elective abortion is the voluntary termination of a pregnancy. And so your text looks at the history of elective abortion. And they found that abortion has been practiced in almost all regions throughout the world since the earliest of times. And it's important to talk about this because women need access to treatment for complications that, occur with spontaneous or unsafe abortion. So as I mentioned before, if they don't have proper, clean, basic medical facilities in order for, assistance, whether the abortion is, legal or illegal or spontaneous or planned, that has to be available for them. They also have to have information and counseling services, and in some parts of the world, women are forbidden to have any information, counseling, or a procedure related to an elective abortion. So, that's something where some countries are much more progressed in that regards, while other countries just don't even have any of that available for women. And so, looking at some of the different world perspectives, presently 2/3 of the world's population allow abortion upon request. So it's not quite something that is as overly heated as it is in the United States, but the problem with those abortions, as I mentioned, is that, if they're not being done safely or, sterilely or even properly, it can cause major issues for the mother currently and in the long run. And so they find that women should be provided safe abortion services to the full extent of the local law. So, if it's allowed in their country, then, they should be safe services. So again, I talked about maternal mortality and morbidity. The maternal mortality rate is the number of maternal deaths per 1 million women of reproductive age for a specific period of time, usually in about a year. And so they found some specific causes of maternal mortality worldwide, so not just within the US, but worldwide. Hemorrhages, so excessive bleeding, as we talked about, sepsis, hypertensive disorders, abortion complications, and then obstructive labor. So all of these different things are kind of the top causes of the maternal mortality worldwide. So next, we have to look at some stages of care in reproductive health. So one of the first stages is prenatal care. So the World Health Organization recommends that the following measures be completed in regards to prenatal care. So there must be information and counseling on self-care at home, including nutrition, safer sex, HIV prevention, and care during the pregnancy, while the person's breastfeeding, if there's family planning that wants to occur, and then also the harmful effects of drugs, alcohol, and tobacco use during pregnancy. Now, some of that to many of us may seem like common sense, like, oh, I probably shouldn't do that while I'm pregnant, or before or during. But unfortunately, not everyone is able to access the information that we're provided in other countries. And so they're just not informed that, smoking during pregnancy can have, an impact on the child, or doing drugs, or excessively drinking alcohol. And so it's important that this information and counseling and education is available for individuals. They need to look at childbirth preparation and danger signs of pregnancy. So you want to make sure that you're prepared for when the child's supposed to come, and be aware of things that can happen while you're pregnant and things that you should avoid while you're pregnant. Support and care for women with HIV/AIDS needs to exist. So if a woman, has HIV/AIDS, whether it be passed down from, their parents, or they've contracted HIV/AIDS, there needs to be support and care for those women. They shouldn't just kind of be pushed over to the side or not worried about. There needs to be assessment and assistance with domestic violence. So as much as we would like to think that that doesn't happen, domestic violence does occur with pregnant women. And so that's something that, assessment and assistance needs to occur to prevent that, and also to assist with mothers who have been domestic violence victims. Confirmation of pregnancy. So, something as simple that we think about as going to the store and getting a pregnancy test is not always readily available for women worldwide. And so the confirmation of that pregnancy is important. Monitoring their pregnancy process, including maternal and fetal well-being. So it's important to go to those different checkups. In the United States, I know a lot of women have to do the gestational diabetes test. You have to drink this disgusting thing to find out if you have gestational diabetes. And so monitoring the pregnancy process is extremely important worldwide. And again, like I said, not everyone has that research and technology available for them to be able to track their pregnancy like most developed countries are. Detection and treatment of pregnancy complications needs to exist, and then also in some situations anti-malarial treatment, a assessment of female genital mutilation, and also deworming. And we'll talk about a couple of these as we move forward. So from prenatal care, we have to look at delivery and postpartum care. So childbirth care increases safety and also decreases complications for both the mother and the baby. So, while there's skilled attendants available, and other healthcare professionals, there's services that are available 24 hours a day, 7 days a week. The proper medicine and equipment are available. Care during labor and delivery. So, is there infection prevention and treatment going on? Is someone available to relieve pain, delivery and immediate newborn care? And, do they provide information or education about breastfeeding? And then also, a referral system for complications and care for the mother after birth. So it's super important that, they focus on the care of the mother and not just, the child that was born. Really, both should be cared about, as they'll have an impact on, everyone's lives, and then it will also help to prevent maternal mortality. So in looking at infant health, we have to use some different terms that are important to describing infant mortality. And so I've listed those here, and your textbook on page 485 have more detail of each of these definitions, but I think it's important that you recognize that these terms exist and what exactly they are, and the differences in between them. So with infant health, a lot of causes of neonatal deaths include preterm births. So we mentioned that, usually with a low birth weight, they may have a severe infection. So sepsis, pneumonia, tetanus, and diarrhea. They may unfortunately have asphyxiation or congenital abnormalities. So a part of infant health that needs to be looked at is infant abandonment. And this does happen more often in China than any other country. And generally it happens because of their one-child policy. And so the one-child policy, generally then people want to have sons, and so female newborns are abandoned due to their gender. And so they don't want to have an excess of daughters, so that couples may then have a son. So they will abandon their female child. 60% of abandoned boys were usually disabled or severely ill. So while they may have had a son, if they were disabled or severely ill, then they will also abandon them as well. And then adoptions are possible for some newborns, but there are some statistics and information that's been found in regards to the one-child policy, where a lot of children in the rural communities of China actually go undocumented. So with them being undocumented, having no identification, basically, quote, not existing, then they're not able to have a better life through adoption, because there's no paperwork in regards to who they are, or who they belong to. Another important part of infant health is water sanitation, and that goes with maternal and also child and infant health. So the World Health Organization found that 1/10 of global disease could be prevented by improving water supply, sanitation, hygiene, and management of water resources. So this is something that really impacts, like I said, infants and children, and then also their mothers, in regards to, the type of water that they are ingesting during pregnancy, what the baby is potentially bathed in, what type of hygiene that it has due to this water management and the water resources that exist. 1.4 million children die annually from preventable diarrheal diseases, and 2.6 billion people in the world lack basic sanitation. So this really is a major issue in regards to our health, and definitely our reproductive health. The next thing is sexually transmitted diseases. So I feel like you can't talk about reproductive health without mentioning sexually transmitted diseases. Sexually transmitted diseases, the primary prevention begins with sex education, specifically about the diseases and prevention methods related to safe sex behaviors such as abstinence and condom use. So like the example I gave earlier of my friend who, they gave out condoms in Africa and taught them how to use them and, kind of in a way why they should use them. That was part of prevention and treatment. HIV infection and reproduction is a major issue. About 700,000 children under the age of 15 years old are infected with HIV every year. So HIV infected pregnant women are at risk of having HIV positive children. It's not necessarily a guarantee, but there is a much increased risk of that. Also for their children being stillbirth, having low birth weights, and also potentially being preterm babies. So children of HIV positive mothers also have a higher mortality rate due to maternal ill health or death. And so potentially if they, are born HIV positive and then their mother eventually passes away, then they have a higher mortality rate because of their mother having been ill and then passed away. So the next thing is violence against women. So the United Nations Declaration on the Elimination of Violence Against Women was created in 1993, and one of the major reasons that it existed was due to the idea of female genital mutilation. So also it may be called female circumcision or female cutting, and some major facts that your text talks about from the World Health Organization in 2014 are that female genital mutilation includes procedures that intentionally alter or cause injury to the female genital organs for non-medical reasons. So they're not talking about, if someone is born with an issue, in regards to their female genitals, this would not be the same. This or a part of their a benefit of their procedure. The procedure has no health benefits for girls or women. The procedure can cause severe bleeding and problems urinating, possibly later cysts, infections, and infertility, as well as complications in childbirth and increased risk of newborn deaths. So that's another reason that this is talked about, is because, if we're having women who are, being victim to female cutting or female genital mutilation, and yet we're trying to prevent newborns from dying shortly after, birth or during that 28-day span, then something like this would not be beneficial to that, especially if there's some other negatives that come with that. So the procedure is mostly carried out on young girls between infancy and age 15. Female genital mutilation is a violation of the human rights of girls and women. And so if you are interested in this subject, there's been a lot of recent articles in regards to the arguments between girls and women who participate in it still kind of voluntarily, or they feel like they have to, or there will be some type of major repercussion from that. And so it's a very interesting topic that I found over the years is getting more and more kind of hype, or people are looking at it more because of that particular idea of that it's a violation of the human rights of girls and women. You can see I've listed here the 4 different types that exist of female genital mutilation, the different ways that it can happen. Now we have to talk about the male reproductive health. So men in sub-Saharan Africa have a significant reduction in their lifespan, oftentimes due to, if they assume a traditional male role, then it can be kind of gloomy for them due to poverty and potentially a lack of job perspective. So that can make the men kind of fatalistic about their futures. So they have a significant reduction in their lifespan. Men on average have their first sexual encounter at least by age 20. Sterilization is common in males and females in different developing countries or developed countries. STDs are highest in men in sub-Saharan Africa, Latin America, and the Caribbean areas, and HIV/AIDS rates are the highest in the world in sub-Saharan Africa. So you can see why my friend was wanting to push the idea of men wearing those condoms, learning how to properly use them, because the HIV/AIDS rates and STDs are so kind of rampant in that area.